HLA-B 5801 is one of 1,500 HLA-B alleles that are known to exist within Homo sapiens, within humans. The HLA-B alleles are in fact involved in presenting antigens to the immune system. They both restrict the type of antigens that are presented to the immune system for reaction, for immunological reactions, but they also select foreign antigens so that they are presented in a proper way to the immune system to trigger a robust immune reaction. Now, in most cases, the HLA-B system, which is part of the Class 1 system, will take an antigen that is foreign and present it to the immune system, resulting in a normal immune reaction to, say, a virus or a bacterium. But in some instances, as it turns out in rare instances, drugs can be presented to the immune system through processes which are not fully understood. And one of those is allopurinol. It's been shown that allopurinol can result in a hypersensitivity reaction, which can be quite severe and in fact life-threatening, ranging from a Stevens-Johnson syndrome type of picture to a toxic epidermal necrolysis type of picture, which is very severe and life-threatening in individuals. And those individuals who have the HLA-B 5801 allele are at greatly increased risk of developing this hypersensitivity reaction. So the idea of doing HLA-B 5801 genotyping to determine if in fact an individual has that genotype is used to prevent people from getting allopurinol if they're at risk of developing a hypersensitivity reaction. The idea of this test is we'll test a patient for HLA-B 5801 because it places them at high risk of developing allopurinol hypersensitivity reactions, which can be life-threatening. The method that we use is called a polymerase chain reaction, a real-time polymerase chain reaction. And essentially what that means is that we have a way of using primers and probes to, in essence, isolate a specific part of the human genome that allows us to look for this allele. We will only get a reaction if this allele or very closely related alleles are present within that human's genome. A clinician, maybe a rheumatologist, maybe an oncologist, maybe a urologist, will consider a patient who has elevated urate levels for whatever reason. Patients who have elevated urate levels, uric acid levels, if you will, oftentimes are put on allopurinol because it's a way of preventing the side effects of elevated uric acid, which can include gout-like symptoms, kidney stones, and so on. When a physician considers putting a patient on allopurinol, they should consider also getting this testing, because it's been shown that in up to 100% in certain populations of individuals who have had allopurinol hypersensitivity reactions like Stevens-Johnson syndrome or toxic epidermal necrolysis actually have the HLA-B 5801 allele. So those are as high of odds as you can get. It varies according to population. For example, in Han Chinese, it's been found in 100% of individuals who have developed that reaction. In Thai populations, it's been found in 100% of individuals who have developed those reactions. But in other populations, it hasn't been quite as high. In Caucasian populations, for example, it's been lower, and in other populations it's been undefined because those populations haven't been studied. The recommendations that have come out along these lines, however, are that if an individual is going to go on allopurinol, they should be tested for this allele so as to prevent them from developing this hypersensitivity reaction. So the workflow goes like this. Physician considers allopurinol. They're aware that HLA-B 5801 testing is indicated in that situation. Before they put the patient on allopurinol, they get this testing done and make a determination as to whether it's safe or not for the patient to be put on the medication. If they're HLA-B 5801 positive, they should not go on allopurinol regardless of their ethnicity, even though certain ethnic groups haven't been fully evaluated yet. It's just safer to go that direction and find some other method for managing their uric acid levels. Well, this test can be run on either oral fluids or on blood. If it's run on oral fluids, there's a specific kit that we use to obtain the collection, and then that's sent in. If it's obtained on blood, it's on EDTA blood, and then we take, whether it's oral fluid or blood, we extract the DNA out of that and we run this test. It's called a qualitative allele-specific real-time polymerase chain reaction. And so again, the workflow is that patient's blood or oral fluids are obtained. They're sent to our laboratory here in Rochester. The laboratory here extracts the DNA and we run the assay, which is a real-time assay. It's a fairly quick assay for us to do, and the results then go back to the physician and they can determine whether or not it's safe to use allopurinol for that patient. No test is 100% accurate. So even if your patient has a negative result for HLA-B 5801, even if they have a negative result, there's still a smaller possibility that they can develop a hypersensitivity reaction to allopurinol. Furthermore, there are other HLA-58s out there. We're most interested in 5801, but the other 58s can interact with this assay and give what we would call a false positive result. It's not positive for 5801 in those instances, but it's positive for other 58s. Not all of the 58s interfere, but some do. And we won't be able to tell precisely which one of those tests that come back positive actually are a false positive. Furthermore, we don't know whether individuals with other 58s, HLA-B 58s, are at risk of developing this condition because they're rare. They haven't been studied adequately. But it's always good to keep in mind that a negative result isn't a 100% guarantee that the patient will not get a hypersensitivity reaction, and a positive result stands a small chance of being a false positive.